Personal policies. Let's look at personal policies and see what happened from 1970 to 2010. One by one, 45 states individually, each one of their legislatures, each one of their governors, individually dropped a guaranteed issue in favor of medical underwriting. So think of it. The state of Texas. The last 3 states to do this were Washington State, New Hampshire, and Kentucky in 2003 to 2005. Those 3 states had guaranteed issue policies, just like New York. And those 3 states said, no, we're going back to medical underwriting. What does that mean? No one gets health insurance on a personal policy if they're sick. Sounds terrible. If their kid has leukemia, they can't get a personal policy. But think of it from the carrier standpoint. Why did the states do this? Because the state said to the local Blue Crosses, which aren't really local, they're national companies today, or United Healthcare, or Humana, or any other carrier, the state said, listen, carrier, I'll let you come into my state and cherry pick all the healthy. Wow, that's pretty good. You mean I can reject anybody just because they're obese? Absolutely. But once you take someone in the state of Texas, or in California, or in Florida, you're stuck with them. He gets cancer, you can't raise his premium $1 for the cancer. What you can do is raise the whole group of everyone in the state. But we know why you won't do that, because then all the people who are healthy leave your group. And you're stuck with the unhealthy. So remember what I said? You can't raise their premium. So the personal policy market from 1970 to 2010 became medically underwritten. And that's what our president didn't understand, frankly. Oh, I'm getting political again. Let me stop. That's what Washington didn't understand when they did health care reform, that the states had voluntarily put in underwriting because they wanted guaranteed coverage for people who change jobs or are self-employed, or incentives to buy health insurance when you're healthy and keep the policy forever. But those days are past now. Everything will soon be guaranteed issue, everything by federal law. And we need to look closely, as we will, at the 5 states that are guaranteed issue today and have been guaranteed issue the last decade, New York, New Jersey, Massachusetts, Rhode Island, and Maine, to learn the lessons of where we're going and how to move health insurance and serve our clients in the next few years. So personal coverage today in 45 states, today and yesterday, costs about half to a third the price of group coverage. And most people get upset when they first hear that. You guys know this. You're all experienced agents. But your average employer thinks, well, I got to get my employees health insurance because it's much cheaper for me to get it for them than they'll buy it on their own. Wrong, wrong, wrong. In 45 states, personal policies are a third the price of group from the same benefits from the same carrier. But why do people think it? It used to be that personal coverage was twice as expensive, not half as expensive, because it used to be all policies, personal and group, were guaranteed issue, and personal applicants were less healthy than group applicants who work for companies. That's no longer the case. Personal coverage has risen in the last 7 years from 12 million to really 35 to 40 million insured, and it's about to rise to the entire marketplace, but not in the way we know the personal market today. Let's talk about group and personal policies. Small group policies became guaranteed issue really in the 70s to 90s. In the 70s to 90s, you always used to hear about companies who got one person sick and the policy got canceled. So state by state, laws were passed from 1970s, most of them in the 1990s, led by the NAHU organization and the insurance and the National Association of Insurance Commissioners, and they basically said small group will now be guaranteed issue. Well, what happened? Let's be honest. In states like Florida, small group became a euphemism for a husband and wife getting health insurance. If you were poor or middle class and needed health insurance, you were screwed. But if you were smart enough to form a business, even buy a Subway sandwich shop or form a fake business of 2 people, you could find an agent to write you a 2-person guaranteed issue policy. So group market became sort of a dumping ground for unhealthy people. More importantly, the employers, as group policies started rising, because the only small groups who it seemed would pay the cost was where the owner had a health issue, and the owner would buy a group policy. And what happens, of course? You get more unhealthy people in the group prices skyrocketed. When groups skyrocketed in price, the healthier employees, number 2 here, left the group market, this is the last 3 decades, for personal coverage. They said, wow, I didn't know this. I could buy a personal policy. That's why personal policies went from 12 million to 35 million the last 7 years. Because they said, I can buy a personal policy much cheaper, I'll dump my group plan. And when they started dumping the group plans, the ones that got dumped were the unhealthy ones. You guys did a great job serving your clients. Collectively on this call, we cost carriers billions and billions of dollars, so much so the premiums went up so much so that the small group market began to spiral into a death spiral. And the death spiral is what we see is when you have an employer of 10 people or 100 or 1,000, and less than half of the employees elect the group plan. Why? Because it's very expensive. Why is it expensive? Because only the unhealthy is elected. Who then continues to elect the group plan? The unhealthy. So you show me a group with 50% or less participation, I'll show you a group that's in the death spiral we call that's going to increase geometrically in price till it's canceled. The big change just happened. Over the last 7 years, and it's something I work very hard in Washington to lobby for, the federal tax advantage of group were extended to personal coverage. So as you'll see in this next slide, the tax advantages of group, which were always way over personal, were extended to personal coverage. So group could be paid for off the books. Number two, POP plans just showed up this past year. Starting 2009, as many of you know, employers can now say to employees, tell me how much of your salary you want to use for health insurance. So starting 2009, employers in all states, and many states have passed laws saying employers must offer this upon request. An employee can come to you in any state in the United States, and it's in Minnesota, you have to do this, and say, lower my salary by $300 a month pre-tax, give me $300 tax-free to pay for my premium on a personal policy. That's big. And then the U.S. Treasury gave tax parity to personal policies. In 2002, the U.S. Treasury said HRAs can pay for personal policies. In 2009, the IRS allowed POP plans for personal coverage, and state by state we passed laws. More significantly, healthcare reform mandates this. Healthcare reform orders employers in every state to offer their employees the right to take pre-tax payroll and pay for personal policies. This is huge. Some small group insurance regulations conflicted, but that's all now a moot issue with the new federal law.